Good afternoon, everyone. My name is Cara Dina Sale. I'm with the McSilver Institute for Poverty Policy Research, and I help to lead all the clinical work here at our Community Technical Assistance Center of New York State. So I'm really excited to be here with you today and to share with you our today's webinar. So today's webinar is called Social Media Use and Mental Health Among Sexual and Gender Minority, also known as SGM youth, which will explore the ongoing research on the influence of social media on the mental health of SGM youth, assist providers, you, in identifying how social media can act as both a risk and protective factor for mental health challenges SGM youth may experience, as well as describe how you all can work with SGM youth clients to create a positive relationship with social media. So welcome, and I see everybody chatting in. Hello, good afternoon, Bridget and Raquel and Anne Marie. Welcome, Marianne, Victoria. Thank you so much, everyone, for being here with us. If you have not joined with us before, I just want to take a moment to orient you to our webinar. If you have, I'm sorry, this is a bit of review, but everyone is placed on mute, but please use the chat box. We will be chatting throughout the webinar. So really happy for y'all to chat in any questions along the way. We will have a Q&A at the end, but also happy to chat in any thoughts you're having or any concerns or anything, but everyone's on mute to avoid background noises. If you have any technical issues, please chat to our host, whose name is Kiara, who's helping us today, and she will be able to assist you. And just as a reminder, the chat box is at the bottom, kind of middle. You can just click that little chat box bubble and we'll help you and chat with you along the way, as I said. For your best viewing experience, you can go up to the top right and click view, and you can click side by side :speaker, and that will be your best viewing experience for today. So I'm going to just want to give many thanks to Dr. Cesar Escobar Vieira, who is the director of the Program for Internet Delivered Interventions on LGBTQIA plus mental health, Pride IM, and assistant professor of psychiatry at the University of Pittsburgh. He's affiliated faculty at the Center for Enhancing Treatment and Utilization for Depression and Emergent Suicidality, ETUDES, the Center for Behavioral Health, Media, and Technology, as well as the Center for LGBT Health Research, all at the University of Pittsburgh. His main research interests include leveraging social media and consumer information technology to improve both mental health outcomes and access to mental health services for minoritized youth and people. He is currently working on several projects related to the impact of social media on mental health, with focus on identifying risk and protective factors for depression among sexual minority individuals and other minority populations, and developing and testing interventions that leverage those factors in order to truly help SGM youth optimize their social media usage and experiences. So thank you so much, Dr. Escobar Vieira. I will now pass it on to you, and you're a wonderful colleague, and we're just so grateful for your expertise and sharing it with us today.
Good afternoon, everyone. Thank you, Cara, for that very generous introduction. And I'm very excited to be here this afternoon. And I hope that some of the things that we'll be talking about this afternoon will be useful to you guys in some of the work that you do with LGBTQ youth in your different practice areas. The next slide, please. So today we're going to talk a little bit about what the bad, the good things about social media and use and LGBTQ youth. And then I'll share with you guys a little model that we're using to try to understand these relationships and how we're building evidence toward better practices on social media that might help this particular population improving their social media experiences and the mental health outcomes associated with it. And I'll share that embedded into some of the studies that we are currently conducting. And so there's a lot of literature out there about a number of bad things, or let's just put it a more academic name, the health disparities, mental health disparities that LGBTQ youth have. And these are only some of them. LGBTQ folks, both adolescents and young adults, have up to 3 times higher risk of experiencing bad mental health outcomes, including depression, anxiety, suicidal thoughts and behaviors, loneliness, and isolation, which are risk factors themselves for the previous outcomes. And this risk is even greater, or the disparities are even greater for those LGBTQ individuals who are early adolescents, identify as bisexual or transgender, and live in a rural setting. So among the general population of LGBTQ people, these particular groups that I just mentioned are even at a greater risk of bad outcomes. And on top of that, just as in real life, and we are seeing that developing every day with current policies in different states. On social media, this population also faces a number of risk factors that have been previously identified in the literature as risk factors for mental health, such as experiences of rejection, discrimination, victimization, or cyberbullying more precisely, and an overall problematic use of social media. So on top of the health disparities that we all know, there are these added negative experiences that LGBTQ youth might have or does have on social media. Then the next slide, please. Despite all of that, a lot of LGBTQ people turn to social media for connecting with others. And this is true for LGBTQ youth. We found that in our own research in general, but especially among certain groups of LGBTQ youth, like transgender youth or youth living in rural areas. They turn to social media for connecting with other people like them, to feel more part of a community, to find support that they feel lacking in their physical environment, and to find and use a lot of health-related information and services as well. So it's somehow fascinating how the same medium in which they might experience a lot of discrimination and rejection is also a source of potential positive outcomes for this particular group of social media users. And this was one of the incentives, and I believe it's for all of us true, for which we are trying to better understand how to leverage social media in order to contribute to these positive uses and outcomes that this particular group seeks. Next slide, please. So how can we leverage this positive or potentially positive relationships with social media? That's a subject of a lot of ongoing research. We are just a tiny part of a big number of researchers and labs across the US and internationally who are working, trying to understand the impact of social media on mental health in general, in the population in general, and in our case, very specifically among LGBTQ individuals. This impact is up to today insufficiently understood and has been focusing a lot over the last few years in the impact of the volume of usage of social media. And when I say volume, I talk about the amount of time that people use social media, the number of platforms they use, and the frequency with which they log on their social media sites. Although this particular line of research has found a lot of contradictory results. So even though longitudinal studies have been conducted looking at whether using more social media is bad or good for mental health outcomes, these studies have had conflicting results. And there's almost the same amount of research talking about the direct association of using more social media and reporting more negative health, mental health outcomes, and the same number of studies saying no, there's no relationship between the usage, the amount of use, and mental health outcomes. So this particular line of research has given place to us looking at other ways in which people engage on social media. And this is where, the next slide, please. This is where a little bit of or not complicated, but complex model has been used in the last few years to look not only at the time and the volume of use of social media, but more so focus on the patterns of use that people have on social media and the experiences they have on social media, and looking at the complex relationship of all these potential risk factors and protective factors on mental health outcomes, such as depression and other outcomes. And this is the type of model that we are trying to better understand in order to identify potential intervention targets that will help not only this LGBTQ youth, but youth in general, to optimize their use of social media and optimize the outcomes as well. Next slide, please. So we've been doing over the last couple of years a lot of talking and listening overall, LGBTQ adolescents and young adults about their experiences on social media, because we wanted to better identify what are the potential risk factors that they face in their social media experience every day, and how these might translate or how these might impact on their mental well-being. So we found in some of our qualitative work that LGBT individuals reported a significantly higher frequency of negative effects when they use social media. But despite this, they still thought of social media as a important source of community support, social support, and connecting with others, and also a way of exploring their identity. So there was, even from the start of the qualitative work that we were doing, they were telling us that in spite of all these negative effects that they felt about their social media experience, there was an important source of support that they perceived, at least from their social media use. And the next slide, please. And we took this to a different kind of analysis, looking at more quantitatively what or how these negative experiences might actually influence negative outcomes. So next. So we look at the association between identifying as a sexual minority and depression, and whether it might be, this association might be potentially mediated by experiencing negative social media interactions. The next slide. And we did find that in a national survey of US young adults, in which about 10% of the respondents identified as a sexual minority, we did find that 1 unit increase in negative social media experiences was associated with a 0.5 unit increase in reporting of depressive symptoms. So what this told us is that there might be a path between the association of sexual and gender minority orientation or identity and negative mental health outcomes that goes through these negative social media experiences. This data was limited because it was in the US general population, and we felt, and this is what we're doing now, that we needed to build more evidence, specifically looking at the experiences of LGBTQ people. But this was a hint that maybe trying to reduce negative social media experiences among SGM people might help mitigate depressive symptoms in this population. The next. Yeah, so thinking about lowering one's likelihood of having negative experiences could mitigate this among this population. The next. So the kind of work that we're doing at my lab here at the University of Pittsburgh is specifically focused on trying to leverage digital health interventions that seek to reduce these negative mental health outcomes among SGM people, especially wherein social media experiences and behaviors may be a risk factor. The next. We have a few ongoing studies, and I'll use 2 of them to illustrate the things that we think could be useful in practical terms for providers when addressing social media use among LGBTQ patients or clients. One of these studies specifically seeks to optimize social media use and reduce perceived isolation among LGBTQ adolescents. And the other is a national longitudinal study on social media experiences and mental health among LGBTQ emerging adults. The next. So when we started thinking about how can we intervene to help reduce negative social media experiences among this population. We did not have a great amount of evidence very specific to LGBTQ youth. What we did have is evidence that my previous mentor and myself were, and other groups were collecting about a number of ways in which social media might associate with depression and other negative things. And a few years ago, we compiled all of these evidence that were focused on general population more so than the LGBTQ people, and came up with a sort of program for reducing the risk for mental health conditions associated with social media use. And this sort of educational curricula, if you will, is comprised by four main elements that I would like to share with you today. We call it, just for the sake of keeping it simple, we call it REAL, and it included working towards reneging negativity that is found on social media experiences, engaging with social media in a balanced way, connecting with actual allies, and working on limiting screen time and the use of apps. The next. So the first of these elements is reneging negativity on social media. And we found there was a lot of initial evidence that negativity experienced during social media exchanges is associated with poorer mental health outcomes, included both depression and isolation. And we wanted to share that with LGBTQ youth in a very practical way. So we developed a number of infographics that we share with our LGBTQ users via a tool that we created that lives on social media, and it's a chatbot that LGBT youth interact with, and they can learn better ways of managing their social media. So can we see the next? We developed this intervention content focusing on not only the fact of trying to reduce negativity on social media, but one thing that we early learned from our research participants is that they wanted to have these advice or these suggestions or tips in a way that was platform specific. So it wasn't enough to just say, well, it's important to renege negativity on social media, but how do we do that on specific platforms? So we started doing that, focusing on as many platforms as we could, and we did that for all the elements of REAL. So for example, this one is specifically focused on suggestions to deal with negativity on Facebook. And the next, we did the same for Instagram, and the next for Reddit, as an example. The other thing youth told us they wanted to see, hear, and read and get in touch with was with the experience of other LGBTQ youth. So the way we approach this is for each of the elements that we, or each of the tips that we give, we try to couple that with things that we heard during our qualitative assessments with other LGBTQ youth, where they specifically touched upon their experience on this or that platform, and we use that as part of the intervention content. So trying to educate LGBTQ youth regarding social media use requires potentially trying to be platform specific as best as we can, and trying to bring examples from the experience of other youth like them. And this is usually because this is what we heard, because other LGBTQ youth like them might have been going through similar experiences as well. The next. In terms of engage with on social media with balance, we found that taking more of an active, for example, more engaged or more participatory role on social media, on the social media community, versus taking a more passive role, seems to be more strongly associated with positive mental health outcomes. However, this component suggests that it is optimal for this active engagement not to pass over into an unbalanced state characterized by addictive patterns. And how to share this with you. And this is how we came up with another form of content, and you can play, but maybe mute it because the video has a song that we don't need to. So the other thing that you've asked us is that when we share these tips or suggestions with them, they want to see different ways of seeing the same content. They want to see the content in form of infographics, like I just show you guys. They want to hear from other LGBTQ youth, and they want to see different formats as well. A lot of them wanted to read things. A lot of them wanted to see animated videos like this one. A lot of them wanted to see videos with real individuals. So when we think about how to better communicate with LGBTQ youth in terms of their social media use, we might need to think about very different ways in which they would like to receive these suggestions and these tips to better use social media. Next. In terms of engaging or connecting with actual allies, a number of studies have demonstrated that individuals with a greater number of social media friends who are also friends in real life or have an actual potential of becoming friends in real life have reported greater social capital, which may enhance well-being. So the next, when we talk about this with our LGBTQ youth, they also wanted to learn concepts. Some of them at least mentioned they wanted to learn concepts and not just mere examples. So, for example, this is a concept that we share when we talk about engaging with actual allies to our research participants. And again, we try to keep it with the other platforms as well. The next. and we focus on this one on TikTok, for example, and we try to keep using things that we hear from other LGBTQ youth in order to reinforce the message of how to engage with actual allies and how to work with connections that are that seem or are perceived to be supportive, but occur with people that one doesn't really know in real life, like with the parasocial relationship in the previous image. The next. And finally, although, like I mentioned earlier, the relationship between volume of use of social media and mental health is a contradictory one. We thought there is reasonable evidence that at least for some youth who might use social media in a form of an addictive pattern, for example, it might be very reasonable to think about a discussion on limiting screen time and limiting the number of apps. So we also include this type of content, and it's an interesting conversation to have, but always focusing on not merely the time that social media is being used, but making it platform specific. We heard from our research participants that sometimes they engage with a particular platform just because other youth are doing it, but sometimes they engage with a particular platform because it's really important to them as a way of expressing or exploring their identity or just finding information about their identity. So balancing the time and focusing the time of usage on those platforms that are more meaningful to them might be a good way to address this particular issue of the overuse of social media. So all of these package of ideas and how to interact with social media, we put it all together in a chatbot that we call RealBot, and we deployed our chatbot on Facebook Messenger to be able to reach out to our adolescent participants, and we tested whether using some of these suggestions and tips were perceived as useful and interesting to LGBTQ adolescents. And the next, we finished conducting a very exploratory study a couple of weeks ago, and where we asked a small number of LGBTQ youth to use the chatbot for about a week, and we measured how do they feel about their social media skills before and after using the chatbot. And although the sample was very small, in order to make significant finding in this case, we did find a trend toward an improvement, an enhancement in their social media skills before and after using the chatbot. And that was pretty interesting, and we also got very useful feedback from them. The next. And I mean, this is a very busy slide, but I wanted to highlight the third column on the right, um, and some of their suggestions are bolded. And this is actually this LGBTQ adolescents telling us that although they did like some of this content, they really want this to focus on other topics as well, like coming out and experiencing discrimination and how to interact in order to form a healthy relationship. And what recommendations can we give them in order to improve their social media use and other things that are very specific to LGBTQ youth that we would like they would like to see on this intervention and learn more in terms of improving their social media use. The next. So, in terms of how this can be translated into practical advice that we can provide right now. Although this, we are still building our evidence in terms of what is useful and what is not, and what is a risk and what is not on social media experiences and mental health. There seems to be an agreement with the LGBTQ youth that they do want to learn about better ways of engaging on social media. They do want to learn more about this process of building relationships on social media, because they are doing it regardless of what we say about what social media being positive or negative. They are building these relationships, and they want to know and they want to learn how to build more positive and healthy relationships on social media. So again, this brings back the idea that although they this particular group realizes the potential risk factors associated with social media use, they perceive they get so many positives from it that they do want to learn on how to tackle these negative factors in order to get advantage, in order to take advantage of the positive things that they perceive. But we need to learn more evidence that are LGBTQ specific in order to be able to bring more evidence-based protective and risk factors to the conversation. And we are conducting right now a study that is trying to do that. It's the first longitudinal study that is being conducted to look at social media use and experiences in mental health among LGBTQ people. And this is a study that is ongoing, and we started with a number of qualitative assessments in order to build a survey, and we are collecting the survey right now. The next. And we can skip this one, the next. These are part of the qualitative things that we have learned. We talked about this one already. The next, yes, thank you. And this is the survey that we are in the process of conducting right now. Our goal is to collect 4 different surveys from the same research participants over a period of 8 to 10 months, really, and look at the longitudinal associations between a number of social media experiences and a number of mental health outcomes. The next. So this is just a table of all the measures that we are including in our survey. I wanted to include this one because on the second column from the left, you can see that we are assessing a number of different ways of interacting and behaving on social media. And the time and frequency of use is only one of them. We're focusing a lot on what people experience on social media in order to identify what are the protective and risk factors associated with this experiences and behaviors. And we are not only looking at depression, we are also looking at a number of other mental health outcomes that are well known to have disparities among LGBTQ individuals. The next. So in terms of where do we go from here? Well, one thing that I really want to stress towards the end of the presentation is that we are still in the process of building evidence regarding social media use and social media experiences and mental health among the population in general, but especially among LGBTQ youth in this case. The evidence is still sparse. The evidence is still building. And about this particular population, it's important to stress that while they constantly remind us that they do see and they do perceive and they do experience negative things on social media, there is this other side of all these perception of positive things they're getting out from social media. And that is a strong motivation for them to try to find ways to better engage, to have healthier engagement on social media. And as researchers and clinicians, it is our job to learn how can we assist them in do that in a productive way. And that is, I believe, the task that has gathered us together today. The next. And this is just one thing that they also asked us to include a lot more in our chatbot, and we are working with that. Constantly provide resources as tailored as possible to their gender and sexual identity, their geographic location, and this was super important for rural living LGBT youth we spoke to, because we heard from them specifically that a lot of the resources that are sometimes at their reach are not specific to their geographic location, to their cultural setting, and they couldn't necessarily relate to these resources. So in all that we do, building resources available to this youth is tremendously valuable to them, as long as we can tailor these resources to their specific needs and their where they are living and playing and getting education at the moment. And with that, next, I just wanted to use the last slide to acknowledge a lot of the collaborators that I work with. And I would like to open the floor to comments or questions or suggestions that you all might have.
Thank you so much, Dr. Escobar Vieira. It's really wonderful to hear of your great research and all of the information you're finding, and as well as sort of one of your takeaways is that we're still collecting information, right? There's so much that keeps continually changing and coming to the forefront around social media and information. So that's a good reminder. This is our time for questions and answers, everyone. So please chat any questions. We only have about one so far. And it's a really good question. So especially youth who are not exposed to large metro areas where LGBTQ plus may be more visible or there may be more resources available. Someone was saying that these are great ways to help, and surely the internet is a great way to find community, but how are we to begin the conversation with youth if they won't share what content they're watching or reading? And even if they are unsure of their identity and internalizing their fears or questions. Any thoughts there about where to start?
Well, I mean, that's very interesting because, well, I focus a lot on interviewing for the work we do. We interview specifically LGBTQ youth. So I wonder if this is the difference. But when we started discussing, even before developing the chatbot, we discussed with them what kind of ways they would like to, in which kind of ways they would like to receive the information and what kind of information they would be willing to share in order to get help or the resources they want. And especially among the adolescents, they were willing to share more than what we usually would think. For example, they were willing to share some of their social media data, for example. They were willing to share some of their content if that would be a way to tailor suggestions, tips, and resources to their specific needs. Now, of course, this has a lot more. This discussion includes a lot more than what research participants told us, because that would require thinking about informed consent for adolescents and things like that, which includes caregivers, of course. But the attitudes that we found in these adolescents, and mind you, they were not necessarily, well, we asked about, for example, whether they were feeling depressed or they might be anxious at the time that we interviewed them. And well, they perceived feeling socially isolated. These research participants were not necessarily depressed or having an urgent need for care, if you will, but they were open, or they had a positive attitude towards sharing some of their social media data. So I think this is an ongoing and evolving conversation about getting that type of information.
Okay, thank you. And some of the maybe engagement skills, right? Around you creating that rapport to really open up your safe space for people to share some of those things. Somebody asked about guidelines for parents or any kind of resources.
Right now, we in terms of resources for parents, I think Trevor is probably the best source, because they do have some
Mhm.
a lot
Trevor
of
Project?
yes,
Yeah, I love that resource. Yes.
Trevor Project.
Mhm.
They have a lot of material geared towards caregivers, either parents or other caregivers, and youth, of course. But I that would be my first and foremost recommendation right now.
Yeah. Yeah, it's a fantastic resource. Thank you. Somebody's asked.
Another resource another resource that is super useful, and I'm sure people are familiar. Common Sense Media has a lot of material geared towards adolescents and caregivers as well, but it's not necessarily focused on LGBTQ youth. But I would say it's very useful as well, and it might give caregivers a lot of good ideas about starting a conversation with their youth.
Okay, thank you. And then there's Callan Lord here in the city that I'm going to put in a link, which is also a really, really wonderful resource for everyone. All right, so sharing a few links there. So someone is asking, are there specific social media platforms used more frequently with LGBTQ youth emerging adults? What were those?
I don't, well, so the answer has two parts. If we talk about ours, is the use across social media apps differently across sexual and gender minority youth and non-sexual and gender minority youth in a statistical way? There seems to be that the answer is no. But what is different is the specific motivation with which sexual and gender minority youth use social media compared to non-sexual and gender minority youth. So the motivation in terms of building connections, meeting other people, explore identity, getting social support, that is a lot stronger among this group of users than others. And they do tend to go to platforms that are maybe not the more mainstream ones. A lot of our youth mention platforms like Discord, for example, or Tumblr as important sources of support, community, and information.
Oh, great to know. So Discord and Tumblr. Okay, I think we have time for one more question. How do you recommend to talk or engage with parents of LGBTQ youth who have been exploring their identity, and Hispanic parents who are not aware of what their children may see in the social media and not ever imagine what is going on in their child's life? How do you go about that?
That is a very interesting question.
Mhm.
I think an important thing to evaluate is, I mean, all kids, well, not all kids, but a lot of them are on social media these days, and if that is a part of the youth's life that they're not sharing or they're not talking about, um, it it is important to ask oneself um, uh, why, uh, and um, and why, as in, am I being uh, uh, a trusted adult in this particular topic? Am I behaving as a trusted adult in this particular topic? Am I uh, am I uh, having the openness to have an open discussion and listen to their experiences regarding social media and regarding the importance that social media might have, the perceived importance that social media might have in their lives at this particular moment. I think a lot of, and they told us that a lot of LGBTQ youth choose to keep their social media experience private, because at some point before they choose to come out to their family members, they're in the process of figuring out what they even think about their sexuality, or what they even feel about their sexuality. Um, and it is hard to put pressure on that particular step of the process. But what I think caregivers, parents can certainly do is to constantly be, or try to be, that trusted adult willing to listen and open to listen those experiences.
Great, thank you. So it's really about perhaps working with the caregiver about being that trusted adult, right? Thank you so much. I think we can go on to show what's coming up in our CTAC world. This is if you want to contact Dr. Escobar Vieira, is that there's his information, and these slides will be available in a few days. And we have some upcoming events that are going to be fantastic. So assessing and treating non-suicidal self-injury, I think that is going to be really helpful and important. Hope you all can join us. And then I have been working with Jan Winhall, who is a social worker for many years, working with polyvagal theory and addiction. So she's going to be doing a 2-hour training on trauma and addiction. We're really excited about that. So if you haven't signed up for that, please consider. It's going to be fantastic. And she has a lot of resources as well. And then Wednesday, April 27th, Dr. Tony will have a conversation featuring Cindy Stanford, who started an amazing organization called ACEs Matter, acesmatter.org. If you don't know about it, check it out. She's doing fantastic work. So those are just some of our upcoming events. Hope to see you again. Dr. Cesar Escobar Vieira, thank you so very much for your great wisdom and great research and information for everyone today. And do you have any last words?
No, just thank you so much for having me. Thank you for the fantastic questions. And please reach out to us if you have any follow-up comments or questions. I'd love to hear that.
Thank you so much. Take good care.
You too.
Bye,
Bye.
everyone.